So this is the sphenoid bone, and today I will be just talking about the presenting parts, anatomical points, and the articulations of the sphenoid bone, inshallah. So this is the sphenoid bone, and it is an unpaired pneumatic irregular bone. And why it is called pneumatic bone? Because it contains the sphenoidal ear sinus. This is the sphenoidal ear sinus. There is a sphenoidal foramen. This is the sphenoidal foramen, and the sphenoidal foramen, it connects the sphenoidal sinus with the sphenoid medullaris of the superior meatus of the nasal cavity. And what is the lining of the sphenoidal sinus? This is actually the pseudostratified ciliated columnar epithelium. And why it is called an irregular bone? Because it is irregular in shape. So let's talk about the basic presenting parts. This is the body of the sphenoid. This is actually a pair of laser wings. This is the greater wings. This is the laser wings. It's actually broken here. And this is a pair of pterygoid processes. This is the sphenoid bone, the pterygoid process. These are the pterygoid process. The pterygoid processes are projected downwards and lies inferiorly. Greater wings are deeply concave and directed upwards. Optic canal is directed forwards. These are the optic canals. Optic canals are directed forwards. And this is the hypophyseal fossa. Hypophyseal fossa lies superiorly in the horizontal plane and is concave. It's the body of the sphenoid. So in body there is 6 surfaces. This is the superior surface. This is the posterior surface. 2 lateral surface. And this is the inferior surface. And this is the anterior surface. Okay, so let's just do a quick review of the parts. This is the ethmoidal spine. This is the jugum sphenoidale. This is the sulcus chiasmaticus, which leads to optic canal. This is the tuberculum sella. This is the hypophyseal fossa, and this is the square bony plate. This is the dorsum sella. So this tuberculum sella, hypophyseal fossa, and dorsum sella altogether is called the sella turcica because it resembles a Turkish saddle. Okay, and this is the basic. This is the basic sphenoid. Okay, and the inferior surface, there is sphenoidal rostrum. This is the pair of vaginal process, and here this is the lower horizontal part of the sphenoidal concha. And anterior surface, there is sphenoidal crest, and this is the upper vertical part of the sphenoidal concha, and it's actually broken here above and laterally to the sphenoidal foramen. There is a quadrilateral triangular area. There is a petrosal process in dorsum sella. There is a petrosal process, and there is lingula, raised margin, lingula. Okay, let's talk about the greater wings. This is the cerebral surface. This is the lateral surface, and here this is the orbital surface. There is the posterior border, and there is the squamosal border. There is a tip, and medial to the tip there is a triangular rough area. And in case of, this is the laser wings. In case of laser wings, there is the upper surface, lower surface, anterior border, and the posterior border. There is the lateral surface of the greater wings. So there is the infratemporal crest which divides this surface into the temporal fossa and the infratemporal fossa. Okay, so there is the anterior clinoid process. This is the medial clinoid process, and this is the posterior clinoid process. So the anterior clinoid process and the medial clinoid process, it forms the carotido-clinoid ligament, and the anterior clinoid process and the posterior clinoid process, it forms the interclinoid ligament. So let's talk about the articulations of the sphenoid bone. In the superior surface, there is the ethmoidal spine. Okay, there is the ethmoidal spine which articulates with the posterior margin of the cribriform plate of the ethmoid bone. So lateral margin of the dorsum sella, it articulates here. It presents a petrosal process. So it articulates with the tip of the petrous temporal bone by petrosphenoid ligament. In posterior surface, there is basis sphenoid. There is basis sphenoid. It articulates with the basic occiput and forms the primary cartilaginous joint, which is actually replaced by bone after 20 years. But if the fission takes place at an early age, like at the age of 15, so in that case, the growth of the anterior posterior growth of the base of the skull will be arrested, and the maxillary teeth of the upper jaw will be failed to adjust with the teeth of the lower jaw. in case of inferior surface, there is the rostrum, the sphenoid rostrum. So it articulates with the grooved upper margin of the vomer. This rostrum articulates with the grooved upper margin of the vomer. And there is the lower horizontal part of the sphenoidal concha, which articulates with the upper surface of the ala of the vomer. This part articulates with the upper surface of the ala of the vomer. Okay, so there is the vaginal process. This is the vaginal process. Here, these two are the vaginal process. So this vaginal process, it articulates the upper surface of the vaginal process, like here, it's just like this. So the upper surface of the vaginal process, it articulates with the lateral margin of the ala of the vomer, and this forms the vomer-vaginal canal, which does not transmit any significant structure, but the anterior margin and also the adjoining lower surface, it articulates with the upper surface of the sphenoidal process of the palatine bone, which actually forms the palatino-vaginal canal, and also it is called the pharyngeal canals. So it transmits pharyngeal vessels and the nerves. Here's the anterior surface. Anterior surface, there is the sphenoidal crest. The sphenoidal rostrum continues with the lower surface of the sphenoidal crest. This is the sphenoidal crest. So we have learned the ethmoidal spine, it articulates with the cribriform plate of the ethmoid bone, but the sphenoidal crest, it articulates with the posterior border of the perpendicular plate of the ethmoid bone. And there is the upper vertical part of the sphenoidal concha. So in the lower and medial part, it presents a sphenoidal foramen. This is sphenoidal foramen. It connects the sphenoidal sinus with the sphenoid rectus of the superior meatus of the nasal cavity. Okay. So in the above and the lateral part of this foramen, there is a quadrilateral or the triangular rough area, like it's broken here. So it articulates with the labyrinth of the ethmoid bone and also the orbital process of the palatine bone. Labyrinth of the ethmoid, and also orbital process of the palatine bone. So ethmoidal spine, it articulates with the cribriform plate, and this is the perpendicular plate of the ethmoid bone, and here the triangular affiliate articulates with the labyrinth of the ethmoid bone and also the orbital process of the palatine bone. So let's talk about the greater wing. There is the orbital surface. So in case of orbital surface, it forms the posterior part of the lateral wall of the orbit. Okay, this orbital surface, it forms the posterior part of the lateral wall of the orbit. And okay, there is upper margin. This is the lateral margin, it is the medial margin, and there is the lower margin. So the upper and lateral margin is articular, but medial and lower margin is non-articular. So upper margin, it articulates with the orbital plate of the frontal bone. It articulates with the orbital plate of the frontal bone, and this lateral margin articulates with the posterior medial margin of the zygomatic bone. Okay. And lower and medial margin is non-articular, as I talked before. So lower margin, it forms the posterolateral boundary of the inferior orbital fissure. It forms the posterolateral boundary of the inferior orbital fissure, and the medial margin, it forms the inferior lateral boundary of the superior orbital fissure. Okay, the posterior border of the greater wing. This is the greater wing, posterior border. It is non-articular in the medial part, but articular in the lateral part. So in medial part, okay, there in the greater wings, there are three foramens: foramina rotundum, ovale, and also spinosum, and there is the foramina lacerum. We can see it in the articulated skull. Okay, so there is the foramina lacerum. So in medial part, it forms the anterior boundary of the foramina lacerum. Okay, it forms the anterior boundary of the foramina lacerum, and posteriorly it is bounded by the apex of the petrous temporal bone. So it is bounded by the apex of the petrous temporal bone. We have talked about the petrous process. It articulates with the tip of the petrous temporal bone, and here it articulates with the bounded posteriorly by the apex of the petrous temporal bone. Okay, there is the pterygoid canal. So there is the passage of the pterygoid vessels and the nerves. Okay, posteriorly. And the lateral part of the posterior border, it articulates the anterior border of the petrous part of the temporal bone. So here it articulates with the tip of the petrous temporal, apex of the petrous temporal, and also here it articulates with the anterior border of the petrous temporal bone in the lateral side. So in the lateral part, along the line of the articulation, there is a sulcus tibialis formed in this. Okay, in this part, sulcus tibialis is formed in the exterior of the base of the skull, and here it lodges the cartilaginous part of the auditory tube. Okay, and this is the squamosal border of the greater wing. It articulates the anterior inferior margin of the squamous part of the temporal bone, of course, because it's called the squamosal border. So it articulates the anterior inferior margin of the squamous part of the temporal bone. There is a tip of the greater wing, so it's actually beveled in the inner surface. So this is beveled in the nerve surface. Okay, so it overlaps for the articulation with the sphenoidal angle of the corresponding parietal bone. It articulates the corresponding parietal bone, its sphenoidal angle, and forms the region of the pterygium. And there is a triangular rough area medial to the tip, which articulates with the frontal bone. See, like this triangular rough area, it articulates with the frontal bone. These are the laser wings, 2 laser wings. Okay, so this is the laser wing, and this is the upper surface. It forms a part of the anterocranial fossa, and it is related to the orbital surface of the frontal lobe. Okay, this is the lower surface. Okay, there is a lower surface. It forms the posterior part of the roof of the orbit, and also it presents the anterior opening of the optic canal. Is the optic canal, and it presents the anterior opening of the optic canal. Okay. There is the pterygoid process. So there is the pterygoid process, 2 pterygoid process. This is the lateral pterygoid plate, and this is the medial pterygoid plate. So there is the pterygoid fossa. And the lower part of the anterior surface. This is affected, lower part, there is affected by a triangular pterygoid fissure. Okay, so this pterygoid fissure, it articulates in the articulated skull. It articulates with the pyramidal process of the palatine bone. So in case of the lateral pterygoid plate, the anterior margin, this anterior margin, there is anterior margin, posterior margin, and lateral and medial surface. The anterior margin is free, and it forms the posterior boundary of the pterygomaxillary fissure, to which the infratemporal fossa, this is the infratemporal fossa, it communicates with the pterygopalatine fossa. Okay, this is the lateral surface. There is the temporal muscle attachment. There is attachment of the temporal muscle, and also it gives attachment of the lateral pterygoid muscle. And in the medial surface, it gives attachment to the medial pterygoid muscle. So this is why the lateral pterygoid plate is called actually the muscle plate. And the lateral surface of the lateral plate, it forms the medial wall of the infratemporal fossa. Okay, this is the medial pterygoid plate. So the anterior margin, this is the anterior margin. It articulates with the posterior border of the perpendicular plate of the palatine bone. It articulates with the posterior border of the perpendicular plate of the palatine bone, and the posterior margin is free. And also, we've talked about the greater wings, laser wings, and subody, and also the pterygoid process. So this is all about the articulations of the sphenoid bone. I hope you like it. Thank you.